Hi, I'm Dr. Bryan DiMarco, and I'm a dentist at Renew Dental. I'm here today to discuss some questions that we get from our patients about dental fillings and to hopefully answer some misconceptions. So one of the main reasons that we'll recommend a dental filling is a dental cavity. So what that is basically we have a hole in the tooth that's allowing bacteria to get in the teeth, and they start to grow and make the tooth unhealthy. Some of the other common reasons that we'll look at doing a filling is that there's a crack or there's an old filling that's starting to break down and allowing bacteria to get into the tooth. So there are some alternatives to getting a tooth filling. One of the main ones would be looking at doing a dental crown. We typically will reserve that for larger fillings because the dental crown is like a helmet that goes on over the tooth and helps to protect it a little bit better. But when the cavity is small, we'll usually just look at doing a filling. So there's a few different types of filling materials that are out there. The main ones that people will typically use are a composite resin filling versus an amalgam filling. So that's a white kind of tooth colored material versus the silver fillings. At our office, we most commonly do the composite filling materials, the tooth colored ones. Some of the main reasons that I like using it is that it allows me to be more conservative when I'm removing tooth structure from your tooth, which is always going to be better for the tooth long term. The other thing is that the material isn't as hard as the metal fillings, so we tend to see fewer cracks that form in the teeth, which is very important because once a crack is in your tooth, it can be very difficult to treat. So when there's a cavity that's in between the teeth, typically the way that we're going to fix it is we access it through the biting surface. We're going to be as conservative as possible in removing tooth structure, but this is typically the best way that lets us get rid of the cavity fully so that we hopefully don't have it coming back in the future. So for a filling procedure, we will typically give anesthetic and numb the area so that we don't have any feeling or any pain while we're working on the tooth. So one of the common questions that we get asked is, am I able to be sedated when I get my filling done because I'm scared about it? That is definitely an option. What we offer at our office is what's called nitrous oxide sedation, which is also known as laughing gas. The reason that we offer this type of sedation is that it's very safe and effective. One of my favorite parts about nitrous oxide sedation is that the effects of it wear off within 5 minutes of the appointment being done. So patients are still able to drive home and go about the rest of their day normally, which sometimes isn't the case with other forms of sedation. So we get asked if there's any side effects after a filling. So in terms of long-term side effects, there's not going to be any side effects with a regular composite filling. And one of the main things that you might notice is that there is some sensitivity in the tooth for a couple of weeks, but that generally is going to get better over time as long as the nerve inside the tooth remains healthy. Another kind of short-term problem is that sometimes because you are numb, it's difficult to tell exactly where you're biting. So sometimes patients will just need to come back. We quickly adjust the filling so that it lines up properly, and then from there, they're good to go. So with dental fillings, we try to do our best with a composite material to match the tooth structure, especially when it's in the front. We'll take care to make sure that we're matching the other teeth. With the ones in the back, it's very difficult to notice them. And typically, because they're so far back there, you can't tell that you have the fillings done. So what I like to tell patients after a procedure is just to avoid eating or drinking anything hot, just so that they don't bite their cheek or their tongue. Once the freezing is out, I tell them they can go about eating as normal. It is normal for them to experience a little bit of sensitivity to hot and cold. That usually will take about 2 to 3 weeks, but it will gradually get better with time. If they have any problems with the way the bite lines up because they were numb while we were checking it, they're free to come back. It's very easy for us just to adjust it and make sure that everything is lining up properly. So a common question we get asked with patients is, do I need to go ahead with my dental fillings right now? It's always best if we can treat a dental filling sooner than later. What will usually happen is that when the cavity is small, you don't have any symptoms or pain in the tooth. This is going to be the best time for us to treat it because the cavity is so small. The longer we leave the cavity, it continues to grow over time and eventually gets close to the nerve of the tooth. And that's typically when patients start to feel symptoms. The problem is by that point, it's usually too late and then we have to go into doing a root canal. So it's always going to be less expensive for you and better for the tooth long term if we're able to just do a filling. So I hope I was able to answer a few questions for you about fillings. If you do have any other further questions or you'd like to just schedule your routine dental appointment, please feel free to give our office a call at 204-259-3804.